In the 13th century, the Persian poet Rumi shared the fable of the elephant in the dark. In this story, a number of men go into a dark room with an elephant inside. Now, these men have never seen an elephant and begin to touch and feel the animal, and depending on where they touch it, they begin to describe what they think they are sensing. One says that the animal is like a water spout after touching the trunk. Another, like a large fan after touching the ear. Another, a strong pillar after feeling the leg. And finally, like a throne after touching its back. Rumi uses this story to share that individual and fragmented perception will often lead to a misguided conclusion. Rumi ends his poem by stating, if each had a candle and they went in together, the differences would disappear. I also wonder what would happen if it weren't all men going into the room, but that's another story entirely. Now, what happens when we compare this fable to an experience of the American healthcare system, which often feels like navigating through a dark room? Let's say I need heart surgery, a coronary artery bypass grafting. Now, first, I need to connect with my own dental provider to make sure I have dental clearance. Then check with my insurance provider, if I even have one, and see if I have the proper funds to pay for my care. I arrange my own transportation to and from the hospital. I connect with my primary care doctor and surgeon who may or may not even talk to each other. So already we have seen that to manage my health for one surgery, I have coordinated with 5 different sectors. Similar to Rumi's fable, our American healthcare system has been built to be fragmented, with each individual acting in their silo, and collaboration with other groups and organizations is labeled as an initiative rather than the design. This fragmentation is not only confusing, but perpetuates the philosophy of individualism, where emphasis is on the individual rather than the group. Now, while Rumi's friends are touching the elephant, did anyone ask, why is this room dark? Why is there an animal in here? And while we are experiencing the healthcare system, who asked, what happened to put my heart at risk anyway? Why aren't these teams coordinating my care or working with case managers? And those are the kinds of questions that happen in public health, the ones that ask about the conditions that led to the situation in the first place. Public health is one of the most reported topics in the media, and that was before our current pandemic. It is a term that has transformed meaning in our recent history. When we hear of what type of bread will make you live to 100, to why a zip code can predict how healthy your lungs are, or how long to wash your hands after returning from finding the last toilet paper roll at the grocery store. That's all public health. And since 2020, COVID-19 became a household virus name. It changed how we worked, stocked up on hand sanitizer, and introduced the latest fashion statement, the mask. We had to be innovative, but we also had a newfound responsibility, not just for our own health, but the health of the population. No more individualism. It wasn't going to work for us. And COVID-19 showed us that our current health system is broken. We do work in fragmented silos rather than a connected system. While every nation was impacted by COVID-19, the United States was especially ripe for a devastating virus to affect our most vulnerable populations. And our most vulnerable populations are made so because of our historically racist and classist structures. These systems were designed to make us like the men in the room with the elephant. Separated, hard to see, difficult to understand. It was time for all of us to think about how everything we do will always influence the same topic, health. Now, for a population health management specialist like myself, this was a conversation we were waiting for, but never wished for. We knew another pandemic was only a matter of time away, and I know you may not want to hear this, but the next pandemic is also around the corner. I know what you're thinking. Can bread really make you live to 100? Jury's out on that one, but I can answer the second thing you might be thinking. I keep hearing the terms public health and population health. Is there a difference? Is public health going to stop the next pandemic? Yes and no. Think of population health as the legs of the elephant. Yes, that story is going to come back. Public health is just one of the 4 parts that lead to stable community design. For the health of a population to be addressed, public health comes together with health policy, quality and safety, and chronic disease management. So not only are you ready for your Population Health 101 class, but you can see how public health infrastructure is not the only answer to addressing health problems and avoiding pandemics. But these 4 different systems need to be balanced for a population to have a foundation rooted in health and be prepared for the next virus. While we are still figuring out each next step in managing this disease, there are 2 things we can all do now to not only address our current public health crisis, but also sustainably prepare for what's still yet to come. The first, the need for every individual, yes, you, to take on the responsibility to think with a lens of health. Now, this is going to address one of the legs, that of health policy. Because what do an educator, lawyer, and artist all have in common, other than student debt? The opportunity to make decisions rooted in bettering the health of the populations they serve in their work. We have a concept called health in all policies, where every law should somehow address health. This also implies health in all professions. Professions influence policies, and health policies influence if a system is designed to put disease prevention first and support those that are most vulnerable, or not. As a country built with policies that were not designed for the health of all people due to discrimination by gender and race, we have a lot of work to do to address health in all policies by breaking down systemic inequities. This is accessible and affordable housing, healthcare, and food security. This is safe fluoridated drinking water. This is being able to get a COVID test or vaccine with reliable transportation. This is accessing quality education. The professions that move toward health in all policies are engineers, school board officials, city planners, hospital executives, everyone. Young members of our communities also play a vital role in uplifting the health of our populations and are already leading conversations that address the health of our planet and people. Having a paying job is not what gives people value or a role in the conversation of population health. Any person, regardless of age or job status, has stakeholdership in population health. For the last few years, the youth led a climate strike in the streets across our world, advocating for policies that would fundamentally address climate. Climate control is directly related to novel viruses. And not only did 2020 see a pandemic, but increased wildfire activity, locusts, and record high temperatures. And in February 2021, we saw southern states frozen over. People in power need to listen to the young voices and act. Now, the second thing we can all do is address the dire need for interprofessional collaboration and communication in our systems, which addresses the 3 legs of public health, quality and safety, and chronic disease management. This is when we move from individualism to collectivism. One of the biggest lessons of the novel coronavirus pandemic was the need for all systems, especially health systems, to have networks of care among community programs, public health departments, and health delivery areas. The 2 legs of quality and safety and chronic disease management are strongest when there is alignment between interprofessional departments and sectors. Now, my professional role is rooted in addressing oral disease prevention on a national scale. Oral health professionals have long worked in silos with fragmented medical and dental education systems, delivery systems, and coverage systems. Our entire system was designed to basically say, let's take the mouth out of the body. If the dental and medical systems were designed to not even speak to each other, what is happening with every other facet of health? Well, as we saw with COVID, it's not doing so great. But things have already changed. Oral health professionals are working and are starting to be able to give the COVID-19 vaccine. Medical and dental professionals are coordinating care with integrated health record systems. There are now more teledentistry options than before that can help coordinate care. We saw a fragmented system is not going to effectively prevent disease. We're ready to answer the question. What are we going to do about it? We're going to move forward now that our hindsight is 2020. Every health innovation and decision will be rooted in what happened in 2020 with the viral pandemic, racially inequitable systems being highlighted in our societies, and the acceleration of climate change. And it's happening in real time. And we're fundamentally going to redesign how we collaborate and build our systems. The lesson of this year will guide us into a healthier and more interconnected future. Bread may not make you live to 100, but our communities can be rebuilt with a population health lens, so we all can. So let's turn on the lights and address the elephant in the room.